Hi, everybody. Thank you so much for inviting me to talk today a little bit. Um, Joel had asked me what my roles have been, and are some examples. So I've been everything from a hospitalist role to developing primary care clinics in remote settings, to developing our med response air ambulance service here in the north. And currently, I am the territorial manager for public health related to COVID immunizations, testing, and rapid response. Okay, really good question. I have to think back a ways because I have done this for quite a while now. But some of the challenges I think when I initially started, especially transitioning from, where y'all are coming from an expert RN position to a brand new NP position. Something that was big for me was role clarity and just trying to find my place within a team. Where does a nurse practitioner fit? And not only with colleagues, both MDs and other nurses, but also with patients, just helping them to understand that a nurse practitioner has an autonomous practice and that you will be following them from beginning to end with, your diagnosis, your prescriptions, your care plan, your diagnostic test, like whatever it is. And so just kind of carving out that what that actually looked like was a bit of a challenge at the beginning. I think too, there was a lot of fear a little bit about like, what am I doing here? What was I thinking? I don't know anything, and just kind of navigating that whole piece of a little bit of anxiety and fear of not knowing. And I think you can get caught up in a bit of isolation in that you do so much to be successful at this role that it can eat up that work-life balance a little bit, especially in that early first year, especially. So I think those are some of the initial challenges that I think of when I think back to that transition time. You are graduating soon, and it's exciting. I'm looking forward to having more young NPs in our field. It's going to be great. Some of the strategies that I did initially was really know your resources, and I would say that's a strategy, but it's also something I recommend. So, like, kind of know where to go to get what you need. So, back in the day, like we had bugs and drugs in a book form. So now you have digital stuff. It's on your phone. It's right at your fingertips. I would suggest up to date bugs and drugs. Know your provincial guidelines or where to find them so that you can quickly look up, what are the recommendations for this type of patient in that province or territory that you happen to be working in. So I think just like knowing where to go is a great strategy to sort of help you. It gives you a little bit of breathing space to know that you can make some of those decisions and just you can clarify it right in front of you. Um, and to know that it's okay to say to a patient, I don't know, but I'll find out. There were times I looked stuff up with the patient with me so that they could read it right off of the same kind of forum that I was looking at. So and then we would discuss it further. And so it's okay to say I don't know, or I'm gonna go ask a colleague because I just want somebody to confirm this with me. Let patients know where you're at a little bit too. I mean, you do have to have confidence, but at the same time, it's okay to be looking things up. Find a mentor or a champion. I had somebody that I was able to go to so that I could just say, you know what, I'm lost right now. I don't know what to do. Or I'm thinking I should do this, but am I on the right track? So finding a good mentor or champion would be another excellent strategy. And then also finding a person, if it's not the same person, but a safe person so that you can kind of decompress from a day that might be challenging for you. I think to just remembering that each person that comes in, it's their own emergency. So I think sometimes it's easy to go, why are they here for that? But recognizing that they have reached out for help, they've booked an appointment with you for something that they want to discuss, and it's their time. So, just listening to patients, listening to their full story, taking a good history can't, like, honestly, your history and stuff leads you to your assessment and leads you to your diagnosis. So, get proficient at those things, and then give yourself a little bit of grace time. Like, take the time to be kind to yourself. And when you have a bad day, it was still a learning opportunity. And I guess that's the other thing I would say too, is that take any opportunity that comes up, even if you don't think it's going to be in your wheelhouse in your practice that you think you're having right now. If there's an opportunity to observe something different or broaden your scope, go for it, because every little thing is going to stand you instead. And remember, you know more than you think you know. These last years of study, you filed all that in your brain, and it's going to be there when you need it. So